Communication in dementia. Problems to avoid. When two people are chatting, a really complex interaction is taking place. Dynamic events are happening, placing a lot of burden on the brain. For example, in this case, the couple need to synchronize their listening and speaking skills, including taking turns to add new material to the conversation. At any one time, the couple are not merely reacting to what is being said. Rather, they are cognitively predicting and anticipating the other person's acceptance of the information that is being offered. In the case of the man, he knows that certain topics are likely to receive more favourable answers, more favourable than others. He is mentally putting himself in the place of his friend. This feature is sometimes referred to as operating a theory of mind. He keeps a check of whether his conversation is achieving the intended goal by monitoring her non-verbal and verbal responses. It's hard work, and you can see why it's so mentally taxing. In any conversation, there are also some general rules that need to be adhered to. On a basic level, you need to be using the same language, or altering dialects or forms of speech that will allow you to understand each other. You'll also need to conform to a pattern of speech that obeys conversational rules. If your pauses in speech are too long, the other person may think there is a problem. Perhaps the pauses represent extra thinking time, suggesting disagreement or difficulty understanding what you're saying. If this is a general chit-chat, then there would be contributions from both people. Although on some occasions, and perhaps in the case of certain individuals, someone may end up dominating the whole conversation. There's also an expectation during effective exchanges that there is consistency between what people say, the manner in which they say it, and their non-verbal actions. These are just some of the rules. Because communication is fundamental to us as social beings, any minor infringements in our exchanges are picked up readily by those we speak to. When communicating with people with dementia, they may be experiencing communication deficits. A useful guide to our approach when speaking to them is to ensure we are mindful of their needs, no matter their level of ability in terms of communication. So in our exchanges, the way we speak and what we actually say should make sure the person feels respected and have a higher degree of control of the situation. We don't want them to feel devalued or pressured. We want to give them the impression we are interested in spending time with them so they feel connected to us. We also want the conversation to make them feel secure and safe. So if they're confused or time shifted, we may need to enter their reality. In most cases, unless we know the person well, we would not want to touch the person or make contact unless there is a sense of connectedness. Once their demeanour suggests they see us as someone who is able to help them, we can offer some physical aid or guidance. In some circumstances, humour or banter may be appropriate. Again, we need to look for signs that this is applicable. When choosing to communicate with people living with dementia, there are some very practical features we need to take account of, merely by virtue of their age. Most people, although not all, will tend to be older. Hence we need to check that those folk who require a hearing aid have it turned on appropriately. The cues people will be getting from lip reading will also be important, so we need to check they are wearing the correct glasses. If the person wears dentures, it's a good idea to check they are in place and people's gums, teeth and mouth are free from discomfort. Poor communication can often be a product of oral difficulties. The environment is also important. As we age, our ability to filter out external noises reduces. And whereas in the past we may have been able to hold a conversation in a nightclub, this skill may have been lost, particularly as our ability to filter out the music and background sound from actual speech may have lessened. People with dementia are clearly at a disadvantage when communicating because they often don't have the mental resources, capacity, and flexibility required to communicate well. Their thinking and processing speed is slower. Their brains struggle to predict and anticipate situations because they are using degraded mental information. Because the information available to them is of poorer quality, they are likely to jump to conclusions or misinterpret situations, and this may bring them into conflict. Also, other people can start to treat them differently, perhaps treating them as being stupid or infantilizing them, or merely talking louder to them. All of these responses can reduce people's self-esteem and increase the burden on their already overloaded processing systems. In the next section, we'll examine the issues that we should try to avoid in order to promote good communication. We have taken our idea from the old do's and don'ts signs that we used to see at swimming baths, such as no bombing, no weeing, no petting. We refer to this section as the PPE of communication. The PPE refers to the 3 factors to consider when producing the guidance: physical factors, psychological factors, and environmental features. This table illustrates some of the features that will be presented in our red circles. As you can see, we want to avoid physical features that make communication more difficult. Likewise, we want to avoid any problematic psychological features. Thirdly, we need to be concerned about environmental conditions that may interfere with good communication. In the following array of red avoidance circles, our first row of circles will be physical factors. The next 4 rows are psychological factors, and the lower 3 rows are all to do with environmental features. In the first circle of the physical factors, it indicates that we need to avoid covering our eyes. Seeing someone's eyes are so important when predicting, anticipating, and interpreting their actions and intentions. Problems can sometimes happen when a carer is wearing dark glasses, so it's helpful to avoid wearing such spectacles. This feature reminds us to check whether the person has better functioning in one ear compared to the other, which is often the case. Hence, we should be aware of this and avoid speaking into the weaker ear. As we want to give people living with dementia as many clues as we can about our speech, we should avoid covering our mouths with our hands. The use of masks during the recent pandemic relates to this issue. We should also try to avoid speaking to people when we are eating food, because this can make lip reading more difficult. When people are in pain or discomfort, they are poorer at understanding and producing speech. During times of acute illness, we should avoid conveying important information because the person may be distracted by trying to cope with the pain. In the next section, we'll be looking at some of the psychological features. This item simply suggests that we should avoid complexity in our speech. The use of simple, chunk sentences, concrete rather than abstract words, and keeping our sentences short with the frequent use of repetition. Avoid the use of negative language. No one likes to hear no. If someone is doing something risky, it's often helpful to tell them what you want them to do instead of telling them not to do what they're currently doing. For example, instead of saying, "Stop kicking the door," say instead, "Hi Sachin, could you come over here and help me carry this box?" Avoid the overuse of pronouns. It's better to use names, because this gives the person living with dementia a clear reminder who is the subject of the conversation. We all like choices, but we should avoid giving people too many choices, because this may overtax the person. If choices are given, clues or pictures of the options can scaffold the task. Avoid rushing the person. We all hate long pauses, and sometimes we try to fill in the gaps. However, people with dementia's slower processing system will mean that pauses are common. We need to tolerate the pause and give the person time to come to a decision on their own, if at all possible. We need to avoid telling unnecessary lies. There is an extensive literature on the topic of therapeutic lying, and deceptive practices have a comprehensive set of guidelines. These guidelines should be adhered to. When they are not adhered to, lies can lead to greater confusion, undermine trust, and may be unethical. People with dementia are not stupid. They are merely using poorer quality mental information to navigate their surroundings. Hence, it's important that we avoid speaking down to them and over-controlling them. Also, we shouldn't be speaking on behalf of someone else unless an appropriate mental capacity assessment has been undertaken. From the work we've done on the topic of verbal judo, we are aware that certain phrases and statements can annoy and upset people. Hence, we should avoid making the following statements. Why did you do that? Calm down. What do you want me to do about it? Don't ask me. We need to speak clearly and carefully, enunciating the words so they are distinct. We must avoid background noise, echo and distraction. Our voice needs to be calm and low in tone. As described in the previous circle, we must give the person living with dementia extra time to process the information. Hence, we must not outpace the person by the speed of our speech or by the use of any body language we engage in while attempting to communicate. Our speech and body language need to be in sync. The use of good, steady eye contact is helpful. Variable gaze, which is inconsistent, could be seen as us being disinterested or suspicious by the person living with dementia. Hence, poor quality eye contact should be avoided. It's important to reinforce key communication ideas. We must use the person's speech and body language to check for their understanding. Owing to the person's memory problems, we may need to reiterate and rephrase statements. Failing to check can lead us to make assumptions that the person has comprehended when they did not. The final section examines the environmental features we need to try to avoid. Firstly, we must avoid the use of demanding and chaotic environments. The person living with dementia will be unable to focus and attend on the conversation in such settings. The person living with dementia will be able to pick up on non-verbal communication late into the dementia. Hence, signs of anger, unrest, disinterest will be understood by the individual, even if only at an unconscious level. When seeking to engage with someone with dementia, it is important to make them aware of your approach and allow themselves to prepare for the engagement. Hence, we should approach people from the front and at a slow pace. Approaching from behind, outside of their declining peripheral vision, can cause them distress and surprise. Hence, approaching from behind should be avoided. Because the person with dementia requires as many clues as possible to deal with communication, good lighting is important. Hence, in communal areas where conversations are taking place, poor lighting should be avoided. We have already discussed that external background noise can be problematic. Hence, the noises from TVs and radios can cause difficulties both in terms of speaking and understanding. When a group of people are speaking, the person with dementia's slowed processing will mean they have difficulties tracking conversations and moving their attention between the members of the group. As such, it's often preferable to relay important messages and have key conversations within one-to-one meetings. This will give the person the greatest opportunity to comprehend the information. On those occasions when a carer is required to touch someone, for example providing assistance with personal care, it's important to prepare the person for that level of intimate engagement. As such, the carer must seek to connect with the person prior to making the contact with them. The carer must avoid, if at all possible, touching someone intimately without initially establishing such a bond. Non-verbal language is often more important than that of the spoken word. As such, it is important to pay attention to one's actions. Slow, purposeful mime and hand signals can often be used to indicate to the person both your friendliness and your intentions. Some carers can find the use of such pantomime hand gestures difficult. However, failing to provide such cues and signals can ultimately cause the person living with dementia distress. Thank you for listening.